Health and Care NHS Foundation Trust. Welcome this evening to our annual general meeting. It's really good of you to give us your time this evening and really appreciate it. Thank you. We are in the unusual position for the second year of holding our AGM online rather than in person, which is really sad because we normally like to have a big event with lots of stalls and presentations and chance to have a real good catch up and network. But tragically, here we are again on good old Teams, which we have all become rather expert in over the last 18 months, haven't we? But I'll just start by making a couple of points about housekeeping, if you will. So unless you're speaking, please, could you keep your microphone off and your camera off, because it generally helps with the connectivity of the call for everybody if we do that. But obviously, if you're wanting to start a conversation or ask some questions, please unmute and put your camera on. Do feel free to write in the chat. Some of you already have, which is lovely. So either put something in chat or raise your hand if you'd like to ask a question. We're going to be holding all of the questions at the end of the session, but you know, if there's something really burning, do chip in along the way through the presentations. We will be recording this session, so if you have got any concerns about that, please let us know. Put something in chat if you've got a concern about it being recorded. If you're someone that would benefit from having subtitles, please turn on the closed captions on Teams. I think, Kate, you were going to put something in chat to guide people through that. But basically, if you go to the three little dots at the top right-hand side of your screen, and then choose Turn on Captions, you'll be able to get captions appearing. So, Kate, if you could just pop something into chat for anybody that can't hear me that needs to use the captions. Excellent. Well, without further ado, then I'll move on to open the meeting. And tonight we're reporting on the year of April 2020 to March 2021. And what a year. I mean, it has been the most momentous year that we're here to talk about this evening. None of us are going to forget 2020 in a hurry as the year that COVID created the biggest challenge imaginable for the NHS, for our country, and indeed for the world. And with regard to our local efforts to rise to the challenge of COVID, our trust has continued to be at the forefront of our efforts, along with our partners, in activities such as testing, vaccinations, and of course supporting people who themselves have got COVID, both in our hospitals and in our community services. And I'm immensely proud of our colleagues who continue to astound us really with their dedication, their commitment, their determination and their expertise. We can't thank them enough. I mean, some people that work for us have done so at enormous personal cost, both for themselves and for their families. And we are really, truly grateful for what you have done, colleagues. Thank you so much. And I and the board really want to offer you all the support and gratitude that we can as we go forward as well. But of course, COVID has also brought opportunities for innovation, and there have been some silver linings, and I think Paul will reflect on some of those when he talks to us about the year. Of course, we do not work alone. We really are very much a partnership organisation, and that is reflected in our strapline, with you, for you. So we work alongside our partners in the NHS, in social care, with the police, with schools, and with a number of other statutory organisations. But really important to us is the work that we do in partnership with the voluntary sector, with people who use our services, with our volunteers, with our experts by experience, with carers and many others. And these partnerships are at the heart of all that we do, and we couldn't achieve anything without a huge joint effort from everyone. And thank you very much indeed to all of you who are represented here tonight for your work with us. We really do appreciate it and couldn't make progress without you. So I've talked a lot about COVID so far, but honestly, we have not allowed ourselves to be completely distracted from some of our other priorities. You might remember that it's almost exactly 2 years ago since our merger took place between Together and Gloucestershire Care Services. And at the heart of that merger, we had 3 big ambitions. One was to integrate physical health, learning disabilities and mental health so that we can better meet the needs of the whole person. And we have made some progress in that respect. We also knew that we needed to do more to tackle health inequalities, knowing that some people die a lot younger than others because of the nature of their health conditions that were avoidable. And thirdly, we wanted to provide really personalised services, beginning with the question, what matters to you, rather than what is the matter with you? And to really listen and co-produce what we do with the people that we serve. So we set sail on that journey, and we were all of 4 months into it when COVID came along. But we have still managed to develop our new strategy for the Trust. At the top end of that is our mission, which is about enabling people to live the best life they can. And in doing so, to provide high quality care, better health for the populations that we serve, to be a great place to work, and to play our part as a sustainable organisation in creating a greener Gloucestershire. So we're going to hear more about our priorities from the coming year from Paul shortly. But once again, thank you so much for joining us tonight, and please do visit our website where you will see a range of resources that we'll be reflecting on tonight. So our annual report, our quality report, you'll also see some videos there and details of some of our partners who in happier times, normaler times, we would have with us with stands in the room. So do take time to have a look at some of those resources. I'm going to hand over now to Paul. Paul is our Chief Executive, and he's going to make a short presentation for you. Thank you, Paul.
Thank you, Ingrid, for the introduction to the meeting, and yes, a few common themes from me in a second. So, hello, yes, my name is Paul Roberts. I'm the Chief Executive of Gloucestershire Health and Care NHS Foundation Trust, and it's genuinely a real privilege to be able to present very briefly, but just a few highlights from the year, and just a few highlights from the year that we're in, and looking to the future. I'm really pleased to see so many of you here and so many partners, many people that we know really well, who have been a part of our wider success as an organisation. So I'm going to start by effectively introducing the review of the year. And one of the things we're formally doing, as Ingrid has already mentioned, is talking about the annual report and accounts. So I will show you that I've got a copy in front of me here, and just mention that if you do look online at the annual report and accounts, it amounts to 176 pages. So you can imagine that I can't really do justice to that in a 10-minute slot. I think there's a lot in there, so I commend it to you, because there's a lot that goes into much more detail about how our organisation is run, what it's done during the year, and what some of the key highlights are. And when we have the range of services that we have, all the efforts and incredible efforts people have made, it really is difficult to do justice to that. But hopefully when you've got a minute, you'll be able to look at our accounts. And Ingrid mentioned that it's nearly 2 years since our organisation was created following our merger. And this is actually our first review of a full year as a new organisation. So last year, those who joined us for the annual general meeting will know we were able to do a review of half of the year for Gloucestershire Health and Care. But this year formally is our first full year in operation as Gloucestershire Health and Care NHS FT. And as Ingrid already says, not quite the year we expected, but a huge amount that has been achieved in that year nevertheless. An annual general meeting and an annual report is a look back. And I always find it slightly strange. Here we are sitting in September, towards the end of September, almost halfway through the next financial year. And we're actually talking about events and things that happened 18 months ago to 6 months ago. So, quite a long time ago. But it is an important milestone to reflect on what has happened during that year, as well as think a little bit about the future as well. So Ingrid has already said this, but as we came together as a merged organisation back in towards the end of 2019, we couldn't possibly have known what was around the corner for us in terms of an international pandemic. And with the best will in the world, with all the other things that we are doing and that we've done and that we'll talk about, the impact of the COVID pandemic has been absolutely a dominant feature of what we've had to do over the last year. And it's impacted on every part of the trust. There's no part of the trust that has not had to make changes, adjustments to services, to do things differently, and to work in a very different way. And as Ingrid's already says, we're just so proud of colleagues right across the organisation who've shown incredible commitment and dedication and professionalism. As Chief Executive, I'm just immensely proud of the way our people and our services have continued to serve communities and citizens in these very difficult, exceptional, unprecedented circumstances. I guess there's always a but there. That my but to that would be, I think we just have to be well aware of all of the impacts it's had on people. So impacts on our communities, on our services, and on colleagues that work in the organisation too. So we can't present that pandemic as anything other than something that has had an absolutely massive impact. We're seeing that in the demand and the pressure on our services now, and our citizens and our communities are still seeing that impact that COVID has had as well. And I don't want to make light of that. It's a huge issue for everybody. But I can't overstate also the personal toll it's taken on many colleagues in the organisation. So I wanted just formally, as part of the annual general meeting, is to pay a tribute to everybody working in the trust. So many people have just gone beyond what we could possibly have expected when we formed our organisation 2 years ago in order to respond to this pandemic and to respond to such difficult and tricky circumstances. I'm really very proud indeed. So just to talk a little bit about that COVID response, because as I say, it's been such a dominant issue. We've got 94 services in our organisation. We're a big organisation and we're complex, and we cover a whole range of services, mainly offered within community settings. And the adjustments, the changes, the conditions in which colleagues have had to work, the redeployment, the complexity of redesigning services on the go as we've tried to respond to a pandemic has hit every aspect of our services as an organisation. But as Ingrid has already highlighted, there's been a number of things that I think we can take particular pride in. the testing services, and those of you here where I'm sitting at the moment at Edward Jenner Court will be aware that we've had now running for 18 months a drive-through COVID testing service. In fact, one of the things I'm proud of is we were one of the first places in the whole country in the NHS to do that. I remember hearing about circumstances being.
This is the biggest topic we've got so far, Paul. Andy.
So we were one of the first places in the country. We'd heard about a service being set up in London and one in Bristol, and ours was set up very soon after that. So we've been working on the swabbing and testing of patients with potential COVID for longer than almost any other part of the NHS. And I can talk about that as a customer because I didn't expect it, but I was actually one of the relatively early customers of our COVID testing services when I became symptomatic in March last year and developed COVID, and I was tested and my test was positive. So I know all about that testing service that we've had in this organisation too. Another highlight that I want to mention here is the vaccination programme. Of course, the vaccination programme has been a massive silver lining. I mean, we were just waiting for that to happen right the way through last year. And of course, when we arrived in November and December, we were beginning to roll out the vaccine to staff and to the public. And we were able to support that programme in a whole number of ways, but in particular, we repurposed 3 of our sites as an organisation to provide mass vaccination sites for the local population. So the Vale Hospital, North Cotswolds Hospital and Cirencester all have contained mass vaccination sites as well. We also were part of a programme which made sure we were able to target vaccinations on those people who might not otherwise have them. So we were able to set up roving services to get to people who would otherwise have had difficulty accessing our services, to make sure communities and vulnerable people that might have been less likely to be vaccinated were able to get those vaccines too. And we continue to do that work. And I would say, you know, if we're talking about silver linings, some of the ways that we've been able to engage with communities and talk about the vaccine and its relationship to health issues has really opened up new avenues of communication for us, which we must try and build on and use much more for other health-related issues as we do that in the future. We've also had to change practice significantly, as I've mentioned already. There was a lot in the news, particularly last year, about PPE, personal protective equipment. And yes, there were lots of difficult moments when we were not sure whether we were going to get the supplies of PPE that we needed in the organisation, but we set up a fantastic logistical exercise to make sure all parts of our organisation were supplied with PPE, and that is all running now. We've had a huge move to enable people to use digital appointments rather than face-to-face. And what we know is, from some of the surveying work we've done with communities and patients, is some people prefer it, some people don't. Some people are able to engage with it, some people can't. And I've got no doubt in the future that that will become a part of what we're able to offer based on what people prefer and what they need. So a blended offer of digital and face-to-face is something that I think is another silver lining that will come out of COVID. One story, which was a really difficult one for us, but I'm very proud of how we responded, was emergency dental care. Now, some of you will be aware that we provide a specialist community dental service, which is largely there for people that, for health reasons, are unable to access normal high street dental services. So people with particular needs or particular vulnerabilities are able to get dental care through our community dental service. Almost overnight, we had to repurpose our dental care services and act as an emergency dental hub because most high street dental practices closed down and weren't able to offer dental care to the general population. So overnight, we were operating as a coordinating centre for emergency dental care across the county, and our dentists and our dental support staff were offering amazing dental care in really difficult circumstances to the people of Gloucestershire, and I'm so proud of the efforts that's been made. We've also had to support flow of patients through our healthcare and social care system in particularly difficult circumstances. So when COVID hit, we had to divide patients into those that we knew had COVID because they'd been tested, those that we knew didn't have COVID because we tested them, but also people that we were suspicious might have COVID, and we had to make sure that they were separated out in our inpatient areas, in our other areas, and that made our patient flow very, very complex. And at the height of the COVID pandemic, we had over 100 people in our inpatient beds in our community hospitals and mental health facilities being dealt with and cared for with very careful PPE, very high quality arrangements in place to look after them. But less visibly, we were looking after patients who were in their own homes, who were in other community settings that we had to care for with COVID or with the suspicion of COVID too. So huge efforts. So moving on, one of the things that the annual report has a look at, and I'm not going to dwell on this, but is the numbers associated with our organisation. And last year, you can see nearly 1.25 million patient contacts last year, a hugely busy and challenging year. And we know, and the national press reported this a lot in terms of our referrals, numbers initially went down when COVID struck because people were not accessing healthcare. But towards the end of 2020, those numbers started to climb inexorably, and the demand for our services has been climbing hugely in recent months. We have over 5,500 people working in our organisation. And as a membership organisation, and it's good to see some of our members and our public governors here, we've got nearly 6,000 public members who take part and are able to get involved in our organisation too. In terms of feedback, John will no doubt talk more about this. 83 formal complaints, always difficult, disappointing and complex when you have to deal with formal complaints, and something we take very, very seriously, but not I hope not surprisingly outnumbered by the number of compliments that we've had in the organisation too. There've been some achievements. We and Ingrid mentioned this earlier. We've not lost our focus on quality, on trying to improve the way we do things, and on the performance of the organisation. As an example, one of the tests that our regulator apply is a sort of balanced scorecard, which they call the governance oversight framework, which measures how well we are governing the organisation. And our score in April 2021 was 1, where 1 reflects the strongest performance for an organisation. And John will talk more about quality of services and Sandra about financial performance a little bit later. Pleasingly, one of the simplest tests of quality, which is our friends and family test, is very, very favourable, with 94% of patients giving us positive feedback on our performance as an organisation, which is gratifying but cannot make us complacent about what we're doing. In terms of other achievements, we were particularly proud of the independent Care Quality Commission Community Mental Health Survey, where out of the 11 domains in which we're measured and patients give feedback, we were in the top 20% of trusts for 8 of them, which is, I think, an astonishing achievement of our colleagues in mental health services. And in the remaining 3, we were average. So we weren't below average in those, but we were average. So always more work to do. But I hope you'll agree that that was a great achievement. Something else we've done in the last year is launch diversity networks in our organisation. We want to make sure that we are an inclusive place in which to work, and we want to understand the different ways in which our diverse colleagues experience working in the NHS and working in our organisation. We've also had a focus on tackling health inequalities, and COVID has brought to light huge health inequalities, which were always there, but COVID has shone a light on those inequalities. So I've talked about some of the work we've done on the vaccination programme, and I've just been very proud to see a number of our staff acting as advocates for the community to try and make sure they get the best possible care. We've launched the Oliver McGowan training pilot, which is about making sure that people working in the NHS really do understand the needs of people with learning disabilities and autism, named after a young man whose untimely death came as a result of widely acknowledged failings in the care of people with learning disabilities and autism. Oliver McGowan, he died in 2016, 5 years ago. We've also shown our commitment to veterans by being one of the first trusts in our region to be awarded Veteran Aware status too. So it's not just been COVID, we've been doing all sorts of other things too. The next slide, it's a very busy slide, but it talks about the staff survey for last year, which shows really good evidence that the trust has valued staff. So if you look at that chart and see the different colours, there are 8 indicators, themes from the staff survey where we are either at the average level or above average for national scores, and only 2 where we're not. And on nearly all of our services, of our themes for the staff survey, we've improved, or at the very worst stayed the same. There is good evidence that if our staff feel valued, then our patients get better care. That there's national evidence for that. So we don't apologise for feeling that is a strong focus for it. So finally, what I'm going to do is just turn to the future. Ingrid mentioned earlier that we agreed a new strategy for the organisation during last financial year. And that's set out and just summarised in this chart. What the strategy is we've tried to make it a simple and clear statement of what the organisation is trying to achieve. So you can see our mission statement, which is our mission is to enable people to live the best lives that they can. And our vision is to work together to provide outstanding care. And we've got 4 strategic aims of providing high quality care, better health, to be a sustainable organisation, and also be a great place to work. And our strategy will influence our business and service plans in the future and be much more translated into very detailed objectives at service level. They'll be used for our staff appraisal system so that people are being appraised against what the organisation is trying to achieve, but also for how the board measures its own performance and governs the organisation too. So that's an important step forward. And my final slide is just to talk about a few things that the trust is aiming to achieve over in the future, over the coming year. One of the things that we're going to be doing is further investing in our estate, in our facilities, because some of our estate and facilities is a bit outdated or needs improvement. So we've got a major refurbishment going on at Stroud Hospital. That's the picture on the bottom right. We've got some major improvements of our community hub in Southgate Moorings. I talked about dental services earlier, but particularly dental services will benefit from that. And of course, we'll be starting the process of building the Forest of Dean Community Hospital as well. And the artist impression of that is the top right diagram. We're going to continue to focus on staff health and wellbeing, and we're going to be hosting on behalf of the system the wellbeing hub for the system, so that we're able to support staff from right across the health and social care system. We're going to continue our work on diversity and inclusion and ensuring, as Ingrid talked about earlier, that people participate in thinking about how we design our services and influencing how our services are organised. And you may be aware that the government has and reorganisation of care into integrated care systems, which means that we will be working much more closely in partnership with our other NHS care partners, our local authorities and third sector colleagues, and we intend to play full part as a really good partner. So thank you for listening to that. That's a brief run through of what we achieved and what happened last year, a quick set of thinking about the future. And now I'm going to hand over to Sandra Bettany, who's going to talk about the finances. So Sandra, over to you.
Thank you very much, Paul. So my name's Sandra Bettany. I'm the Director of Finance for the Trust. I'm hoping we've got some slides popping up for you shortly. So I'm going to be talking about the accounts, which is always an interesting subject, and people will know I can talk about it for a long time, so I'll try and do it briefly and give you a quick canter through. If we just move on to the first slide, please. So the first thing to say is, as Paul was mentioning, this covers the 2020-21 year, and it's the first full year of Gloucestershire Health and Care. Just so you're aware, the comparative figures cover services for a full year of the previous Together NHS Foundation Trust and half a year of Gloucestershire Care Services. So if you're looking at the comparators and you're thinking, well, it doesn't quite match up, then that's why, because you've got a full year of one organisation but only half a year of the other, and that's because of the way that merger accounting works in the NHS. The other thing to be aware of, if you're looking at the accounts and wondering why some of the figures have changed so dramatically, is that the previous accounts until March 2020 included the provision of Herefordshire services. These transferred on the 1st of April 2020 to Herefordshire and Worcestershire Health and Care Trust. So that obviously makes quite a big difference, and the number is there on the slide so that you can just sort of take that into account when you're looking at the numbers. So there are a few caveats if you're trying to figure out what's going on in the accounts. If I can move on to the next slide, that would be helpful. So as you can see, a huge amount of our income comes from our clinical commissioning groups, and in fact most of that comes from Gloucestershire Clinical Commissioning Group. I know we've got Mary Hutton on the call representing the CCG here tonight. We do have income from other NHS provider trusts for patient care, and we also have some of our services are commissioned by NHS England. We've then got a range of other commissioners, so we've got local authorities. I know Kim Forrest is on the call, and that's related to patient care. And then education and training, which mostly comes from Health Education England. For this year, and this year only, we also had some very special funding for COVID, and I'll tell you a little bit about how we spent that later on in the presentation. So moving on to our next slide, I've got a breakdown of expenditure. Now, as you can see, huge amount of the expenditure is on salaries and wages, and the second biggest chunk is on social security and pension costs. So if you take those two together, that's really our pay costs as an organisation. Once you've taken those out of the equation, all of the other segments are relatively small. You can see that obviously we buy clinical services, we also buy clinical supplies, as well as non-clinical supplies. The biggest chunk after you've got through those really is the premises costs and depreciation, which is the cost of writing down our assets over the years in which we use them, and capital charges, which is the fee that we pay to the Department of Health for the assets that we use. So if I just move on, the next slide is the expenditure by directorate. So 70% of our expenditure is allocated to direct service provision. That's what you'd expect. What this slide is shows you how that breaks down across our directorates. This is the way that we organise our services for the management internally in the organisation. And it just gives you a bit of an idea about the spread. The bit that says non-operational, which you might be wondering about, is the kind of dusky peach colour on my screen. That's the public dividend capital, which is the fee that we pay to the Department of Health for the use of assets, depreciation, which I've just mentioned, and impairments, which is where assets change their value between years. So just in case you weren't quite clear what that was. Other than that, I think most of the other headings are relatively clear on that. but that just gives you a bit more of a subjective breakdown from the previous slide. Just moving on then to the next slide, please. I said I'd say a little bit more about COVID. Obviously, we had extra costs this year, as Paul has mentioned, in respect of our response to COVID. We had more workforce at some points in the pandemic. We had people who came out of retirement and returned to the NHS to help us with our efforts to keep services running and to bolster services. As Paul mentioned, we also ran a testing service, both for the virus itself, but also for antibodies for colleagues in the service, so that we could work out what the position was amongst our workforce. As Paul mentioned, we also ran parts of the vaccine programme in conjunction with our partners in Gloucestershire Hospitals NHS Foundation Trust. I know Deb's on the line tonight. We also had to change the way that we worked, so we had additional our existing workforce, but working additional shifts. People worked really hard, and obviously there was a cost to that. There was a lot of extra cost that we had to run for decontamination. That was particularly extra cleaning on wards, bringing locations back into service after we'd had outbreaks. We had more backfill, we had higher sickness absence, although I think it's fair to say our sickness absence during the year for COVID was relatively low compared with what was actually going on in the country as a whole. We also spent additional money on remote working. We did get some of our costs were actually funded nationally. So, for example, the way that we're working on MS Teams right now was funded nationally. We had Attend Anywhere, which is the way we did a lot of our electronic consultations, but we did have to put some additional workarounds in to make all of that work. And so that's just a little bit of an idea about how COVID affected us. These costs were actually funded either through top-up, or they were funded direct as a result of the, for example, the testing service was funded direct from NHS England, and so we didn't have an impact on the rest of our services as a result of this, but it's quite a huge amount of extra money that we spent in this year. I'll just move on to the next slide. This is just a quick overview. As Paul said, I'd say a little bit more about it. We did operate in a revised financial framework in the 2021 year, and we're still operating in a revised financial framework now. So it's been quite a complicated year because we had to change the way that we did our reporting. Our financial performance target changed to a break-even target, whereas previously we were aiming for a surplus, but we met that revised target. Amazingly, and I don't quite know how we managed this, but we did deliver a £10.8 million capital programme in the year, which, considering we were really struggling with even being able to get contractors on site at some points in the year, was an awful stretch, really. And we delivered the majority of that capital programme in the last 2 to 3 months of the financial year, which was really difficult to do. The good news in that is it meant that we were able to continue some of the work that we'd started actually prior to COVID and progress some of the schemes, which included things like putting additional anti-ligature equipment in place, upgrading some of our estate, to make it more fit for purpose, and starting the work on en-suites in our low secure service. We also achieved 3.6 million of recurrent savings. I have to say a large amount of that was done prior to COVID, but that was a huge effort for budget holders when we were also going through our preparations for the pandemic, and I've already gone through the COVID costs. We actually entered the year with quite a healthy cash balance, and some of that was to do with the way that the COVID financial framework worked, but that cash balance will go back into our capital programme over the next 5 years. Just moving on. This is just the headline figures for 2021. This is where you start to see all the caveats that I mentioned about how the previous years look. So just at the top there, the columns that are in green are together only. The columns that are in blue, the first one, the 2021 one, that's the GHC position, and 1920 is a mix between the merged organisation and the previous together organisation. There are some notes at the bottom of the slide, some of which repeat what I said at the start about the Herefordshire mental health, some of which talk about the impact of impairments. That's where we actually have assets that are worth less as a result of market conditions. And in some of the years, there was a situation called the provider sustainability funding in play. That you will see started to slow down, and in 2021 was really about top-up funding, which included the COVID-19 reimbursements. But that just gives you a bit of a view about what's going on between the different years, and a bit of a trend analysis, if you like. So just looking a little bit more closely at our 2021 position, if you look at the accounts, and as Paul said, it's quite a lengthy document, you'll see that we actually had a deficit for the period, whereas I'm saying we got to a break even. So this slide just explains how we've done that calculation. And it also shows the same for the previous year, which is even more complicated, which I struggled to do last year, so I'm not going to repeat, but I'm happy to take any questions on that. So in the 2021 year, you can see that we had a deficit of 5.9 million, but £6 million of that deficit was actually because of a loss because of the transfer of the Herefordshire services. So we take that out of the 5.9 million, which actually broadly gets us to a surplus position. We then have some impairments that have been taken to the income and expenditure account, and because that's just a movement in the value of assets, that's not counted as part of our performance. We then also take out depreciation on donated assets, and the impact in 2021, we also take out the impact of consumables donated from Department of the Health and Social Care bodies. That relates to the PPE equipment that we had, so the personal protective equipment that we used during COVID, and there was a slight adjustment because we had slightly more equipment at the end of the period than we did at the start of the period. And if you take all of those adjustments into account, that's why I say that we made a surplus, in spite of the fact, if you look in the accounts, it's a £5.9 million deficit. Now, if anyone wants me to go over that more slowly, I'm more than happy to, or you can email me offline for a more detailed explanation on any of those figures, or indeed ask a question at the end of this. So hopefully that makes sense in terms of our 2021 financial position, if you're trying to translate it from the accounts to what I've said during this presentation. So just a little bit about capital. Paul's showed you some of the nice pictures, and I've just got a graph, so this is quite a dull slide in comparison. You can see there the split about how we spend our capital expenditure. So we've just split out the Forest of Dean project because it's rather a large project. You can see that the majority of our capital programme actually goes on estates, health and safety and maintenance schemes. That's about 50% of our capital programme. And about 40% goes on IT infrastructure, really important, especially in this year. Otherwise, we wouldn't be able to join these kind of meetings on Teams if we had laptops that were falling over, etc. So that gives you a little bit of an idea of where the 10.8 million has gone. There is a small chunk that goes on medical equipment, also very important to make sure that we keep our equipment up to date. The last thing to say is about the audit of the accounts. Our external auditors are KPMG. They completed their audit with no issues in June 2020. We're very lucky that we have very effective auditors. They issued an unmodified audit opinion. That doesn't sound necessarily that great, but that means actually they didn't find anything throughout the audit. And they also issued an unqualified value for money opinion. I must say that value for money is perhaps not the term that I would use to describe the work that the auditors do. Anybody that was, I know we've got governors on the call, anybody that's on our recent governors call about what the auditors actually do will probably agree with me about the term. But basically, it means that the auditors found that we had adequate processes in place to assure the way that we use our resources. That's it from me, and I'm now handing over to John Tremains to talk about quality. Over to you, John.
Thank you, Sandra. And I'll wait for the team to bring up my slides. Good evening, everyone. It's absolutely brilliant to see you all again. Here we are again on Teams after last year. And wow, what a year. I can only echo what Ingrid, our chair, and Paul, our CEO, has said. Just a massive thank you to all our staff. Of course, our care staff in terms of our therapists, our medics, our nurses and their support staff, but also to some of our perhaps more unsung staff, such as our facilities staffs, our finance teams, our IT teams. I saw some brilliant work in this last year that kept services going, kept wards clean, kept people fed, and kept the information flowing under great hardship throughout the year. An interesting time for me to be presenting a quality report, in so much as you could all understand, many of our quality indicators nationally and locally were paused or stopped for the year because of the COVID pandemic national response. So in our quality report for this time, we haven't reported the range of indicators that perhaps you would see. But what I can assure you is that we didn't miss a beat in terms of monitoring quality and reporting it internally and to our stakeholders throughout the year. I again have to say another thank you, and a thank you to our non-exec directors and also our governors for their absolutely fair challenge and oversight in holding us to account. Our trust board, if I could get to the next slide, team, I don't know if it's delayed or we've got lag. Now I can see it. Our trust board receives a regular quality dashboard that also goes to our quality committee, and we didn't miss a beat on that throughout the year. As I said, we continually monitor the feedback that we receive from people who use our service, the carers, families, and we constantly seek to see how we can use that. We work well with our commissioners, and we also liaise with our regulators in terms of the Care Quality Commission and also NHS England and Health Education England and some of the other arm's length bodies, and we continue to have a CQC rating of good with no enforcement activity or reviews or investigations to report in that year. So if we go to our next slide. A bit about how we monitor quality and embed learning, and that's a big theme for us since we merged into GHC, and we've focused a lot in the last year in strengthening our resources and our approach to learning from incidents and investigations, learning from complaints and concerns, making sure we've kept our audit activity in line, making sure we've got good performance reporting data, and triangulating that between wait lists, quality, incidents, concerns and feedback to really listen to people, use that information, take it seriously and feed that back into our services, all on our quest to give the best care that we can in Gloucestershire. If we go on to our next slide. Our serious incidents, we report this in our annual reports. We monitor this monthly. Again, with great sadness and regret, I report that we had 31 incidents of a serious incident nature in our mental health services in 2021 and 7 in our physical health area. A bit of a difference in the physical health area, and we think some of that was very much due to the changes in service delivery that we experienced through last year due to COVID restrictions. Again, a strange year for monitoring data in terms of quality metrics. Again, all our serious incidents are investigated by our patient safety team and clinicians. All of those colleagues have got training and experience in root cause analysis. And we also, wherever possible, seek to share those reports candidly and openly with families and carers and listen to feedback constructively to learn from where we've made mistakes or where we could do things different again in the future. Next slide, please. So part of our quality management isn't just measuring data. It's not just looking at graphs, etc. It's listening to our colleagues, and we've got a really good culture of speaking up in the organisation. Sonia Piercy, many of you will know, is our Trust Freedom to Speak Up guardian, and I was really pleased to see the increase in freedom to speak up cases last year. Some people might say, gosh, is that concerning, John? But we've really promoted this, and we've also got a whole range of forums of how colleagues in the organisation can raise their valid concerns. Paul, our CEO, has an open door forum. We do regular staff forums. We do team talk. We have confidential portals that you can get contacted with. And wherever we go from a quality team perspective, we're saying to people, if you're worried about something, let us know. Can we do something a little bit different to make it better for you? And that culture is one that I'm really proud of in GHC. Next slide, please, team. So one of the things we did do despite all the COVID disruption is that we cracked on with getting our quality strategy drafted up and written. And in the next month, I'm going to be really pleased to be sharing that with you all publicly. I know my colleagues laughed at me because I was most anxious as a new director of a new trust that I didn't have a shiny new quality strategy to brandish from day one. But we took our time as an organisation to make sure our strategies were coordinated. And also what I'm very proud of, and I've had some great support from yourselves and also colleagues within the trust, is that we took some extra time to truly co-produce this work, listen to people and reflect that in our quality strategy. You can see our goals in there. It's not all about CQC ratings of getting to outstanding. Of course, we want to do that. But what I'm more interested in is the anecdotal feedback and the passing feedback that people feel truly heard and listened to. And our outcome measures actually demonstrate in hard metric, evidenced ways that we're delivering good care. So that's our quality strategy, and we'll be getting that out publicly in the coming month, I hope. Next slide, please. From our quality strategy, and this is just to give good colleagues and interested parties a look at it, we're devising our quality management system, which is a all-encompassing governance process that actually joins up our aims as an organisation, and it joins up our aspirations for a good and effective culture in the trust, but aligns it to some really good hard governance approaches in terms of controls, improvement methodology, plans and assurance. And that's the backbone of our quality approach going forward in the organisation. And you'll get to see more of that in the strategy as it gets promoted, all with the intention to make sure that we can do what we say we want to do, which is give good care to everybody. Okay, and next slide, and I think I'm coming towards the end of my presentation. So our quality priorities for this year, what I did with my team is I said, though there'd been a national pause in monitoring and some of the regulations and the reporting of going through, I didn't want us to be delayed again this year. So we recast our quality areas of focus, much of which you'll be familiar with in previous quality reports from the trust. So for example, our commitment to reducing suicides in those that use our services, working with our learning disability and children's services to promote really good access to healthcare, alongside the stuff like improving pressure ulcer care and reducing falls. Those are our key indicators for the year, and we will be reporting on them regularly and providing metrics in our next annual report around that. And our final slide is just a bit of a sneak peek in terms of our pressure ulcer quality work. So the team and our nursing staff, our therapy staff and our health care support workers out in the ICTs and on the wards been working really hard on improving this work. And you'll see there in the blur of the graph there, our benchmarking data as a community trust is looking good. Things are improving, and we're seeing some really good improvement from all the hard work that colleagues are putting in to improve the quality of care in our organisation. And I'll end there. I'm very mindful of time, and I'm going to hand back, I believe, to Ingrid.
Thank you very much to John, Paul and Sandra. And in a couple of minutes, we will give you an opportunity to ask questions about that huge amount of information that you've been given. But first, we have a presentation from Chris Witham, who is our lead governor. He's a public governor representing the constituency of the Forest of Dean, but he's actually on holiday this week, so we don't have him here in person. And at this point, all of us are crossing our fingers and toes to hope that the technology works for us and we are able to show you the recording that he has done of his presentation. So here goes.
Good evening, everyone. I'm Chris Witham, and I'm the lead governor for the Trust. And I'm here to give you the update on the Council of Governors. I'm sorry I can't be with you in person this evening. I'm taking some annual leave. But I'm sure if you do have questions, you can either email them through to me or Anna will collect them and share them with me. And I'm sure there's other governors at the event tonight who will be able to answer questions about the work we do. Before I start our Council of Governors update, I want to say a huge thank you to all the staff and volunteers across our organisation who've worked so phenomenally hard in very challenging circumstances throughout the last 18 months and the pandemic. I know that that's been particularly challenging and there's been a lot of things staff have had to deal with, but I know that services have continued to deliver excellent levels of care, and I myself had the fortunate opportunity to be treated by some of our colleagues, and I was really grateful for the care that I received and was able to see firsthand some of the excellent work that goes on across our organisation. Thank you to everyone who makes our trust what it is and delivers patient care and looks after people in our communities. So, Gloucestershire Health and Care NHS Foundation Trust inherited Foundation Trust status from Together Trust when the two trusts came together on the 1st of October 2019. And as a Foundation Trust, we have a membership body, and that comprises of public and staff members. And the membership then elects people to represent them on the Council of Governors. The role of the governors is varied and interesting, and we have some elections coming up in the near future. So if you're interested in the role of the governors and would like to get involved or find out more, do please contact myself or Anna and we can talk to you about that. The role of the governors is essentially to hold the non-executive directors to account for the performance of the board. And we do that in a variety of ways, and we ensure that we represent the interests of all the trust stakeholders, staff and public, service users, patients, and all our citizens. And we do that through the governance of the organisation. We also have an important role in communicating the key messages from the Trust back to the electorate and the appointing bodies from which governors come. So in total, we've currently got 15 public governors across 7 constituencies. We have 8 staff governors from 3 different groupings of staff. We have 2 appointed governors representing particular bodies, and we have a wonderful trust chair who I'm sure you're all familiar with. Ingrid is wonderful to work with, and a big thank you to her as well for all her work throughout the last year and for all her support and guidance to me as I took on the role of lead governor. So a little bit on membership. At the end of 2020-21, we had a total membership of 10,618 members. 5,987 of those were public members and 4,631 of those were staff members. And the membership is roughly spread evenly across the constituencies by population. So we have a good representation from right across the area that we serve. We've had quite a lot of challenges in the last year and a lot to learn as governors. Myself and a number of members of the governors are new to the role and have had to get used to the organisation and get used to the role, but found it a very supportive and encouraging environment to work in. The Council of Governors have held 5 formal meetings, and we've had 2 excellent development sessions that were led by NHS providers, part of their Govern Well programme. And that focused on the role of the governors and how we can be effective in our role of challenge and holding the non-executive directors to account. We've approved changes to the Trust's constitution in relation to the number of staff governors to ensure appropriate levels of representation on the Council. We've received feedback from appraisal processes, both for the non-executive directors and for our Trust Chair. And it's been really great to see that even during such challenging times and lockdowns where we've not been able to meet together, that we've continued as an organisation to have a very robust and complete feedback and appraisal process for the non-executive directors and our Trust Chair, and some excellent feedback has been received throughout that. We've approved the new membership and engagement strategy, and that's really exciting, looking at how we can be effective as governors, but also as an organisation to attract new members and ensure that our membership are effectively engaged and brought into the both the governance and activity of our organisation. And we have a new governor committee that now focuses on membership and engagement, and some really exciting work is coming out of that. We've received and discussed the results from the NHS staff survey, and we're having follow-up sessions to ensure that recommendations and feedback from that are being put into place, and that we, as an organisation, continue to take care of all our staff. And we've also received the CQC Community Mental Health Patient Survey, and we're looking into the results of that. We've provided comment and feedback on the development of the Trust strategy and how service delivery will evolve over the coming years. We've received updates and been close to the development of the new Forest of Dean Hospital business case, and also the designs for the new hospital and the excellent facility that we will have for our staff to work in and for patients to receive care in. So the year ahead, we will continue to be working hard. We will continue to seek assurances around Trust performance and delivery. And to do that, we have a new governor dashboard that we've been working on over the last 6 months to ensure that governors have got access to the right data easily, so that we can continue to see the assurance, and where we have concerns to raise questions and get further information around that. We will continue to enhance our membership strategy. Members are really important to foundation trusts, and providing engagement opportunities, especially as it's challenging and not everyone is able to or willing to meet at face-to-face events now. So we're looking at how we might engage more with our membership online. We want to build on ensuring that the council is representative of the interests of the people, both with physical health conditions and those with mental health conditions and learning disabilities, and make sure that as an organisation we're caring for and serving the whole of our population. We're going to continue to promote governor attendance at local and national events, and it's been really great to both attend and receive feedback from other governors who've attended different governor events and trainings, and even the National Governor Conference has been able to take place online twice despite the lockdown conditions. And it's a great opportunity for us to meet with governors of other trusts and learn from them and see what other trusts are finding to be effective. The Trust's constitution was amended in November 2020, and that's to reduce the number of staff governor positions on the council. In January 2019, the constitution had been expanded to put in some provision for the recruitment of additional governors from Gloucestershire Care Services, and that was following the merger, to ensure that there was representation from both of the organisations that were merging to form our new organisation. Now that we've balanced up the governors and we've got good representation from across the organisation and from across different interest groups, that will fall back to seven staff governors in line with similar NHS Foundation trusts. And there's some more information on the slides as to how those posts will change, and that change has been approved by the Council of Governors and the Trust Board. So I hope that's been useful as a brief insight into the work of the governors. I'm still learning what's involved being a governor and how I can be effective in being a governor. But we are here to represent you, whether you're a member of the public or a member of staff. And so if you have any questions or concerns, I'd really like to hear from you. And my email address will be shared following the meeting. And you can also contact us through Anna Hilditch, who does an excellent job keeping all of us governors up to date and informed as to what we need to know and making sure that our meetings run smoothly and are effective. So I hope the rest of this evening goes well. I'm looking forward to catching up with the other presentations when I return from leave, and I really look forward to working with all of you in the years to come. Thank you, everyone. Good night.
Thank you to Chris in his absence, and a big few that it appears that the video recording did work. However, if you couldn't see it or hear it for any reason, there is a link to the recording which has been put into chat just a couple of minutes ago. So if you did have problems, you can catch up on the video through YouTube that way. I would just like to say, because there are quite a lot of our governors here tonight, a really big thank you to them. They do an enormously important role, as you've heard from Chris. And to me, they really are important to us as an organisation, which I said at the outset is all about partnerships with the people that we serve and partnerships with our community. Over there on my office wall, I have a big poster which has the opening words of the NHS Constitution on it. And the very first phrase in the NHS Constitution is, the NHS belongs to the people. And I really believe through having a membership and that membership electing our governors, that helps us to really be connected to the people that the NHS is all about. So thank you, governors. You really are important and we really value your work highly. Thank you so much. Okay, I think we are ready to take any questions. I know that Bren McInerney has flagged on chat that he has a question to ask. And Laura, you asked a question about staff sickness rates, which I think Neil has answered on chat, but we can come back to that one as well. Is there anybody else that would like to raise a question with us this evening? No? Okay, Bren, we'll go to you first then and then come to Laura.
Thanks, Ingrid, really. Ingrid, before I take my question, really, could I take the opportunity to thank you for consistently at all your board meetings allowing patients to say something, even if they might not put a question there, but also taking public questions direct to your board, really, so they're aired at your board and discussed at your board. And it was an opportunity that I took outside of Gloucestershire to talk about good practice on those trusts on their journey to outstanding as an example of that. Thank you, Ingrid. And also I'd like to thank all the people at your organisation across NHS, but also across all sectors of our economy that are just doing phenomenal work in really difficult times. So I want to thank your organisation, Ingrid, but the larger organisations beyond the sectors as well. Thank you. I wanted to pick up the point that Paul highlighted around inequalities and COVID, and absolutely right that COVID has exposed some more. But I spoke to someone yesterday really that really challenged me on where have you been, what have you done? And I had to say that I've been here, but the honest truth is I haven't done enough, really. And I think in Gloucestershire and beyond, and it was a point I raised yesterday outside Gloucester, is we shouldn't be too proud of what we haven't done to address inequalities in our county, not just in terms of mortality rates, but in terms of time spent in unhealthy living. And I went back through some of my questions that I've asked boards over many, many years, really. And I had a little tear last night, and I went back to the person and I asked permission to be trusted. And I think that's a key part of going forward in inequalities, is not just to say we've got this plan in place. Actually, have we got the trust of the people that we're serving to deliver on that? And I think that we have some way to go. I'm not saying we haven't got there, and we can always do better, but that certainly wasn't what I heard. So I'm pretty ashamed in Gloucestershire in terms of the health inequalities position we're in. Certainly not proud of it. I'm also aware that we have done things on inequalities as well, but it hasn't been consistent enough, it hasn't been robust enough, and I'm not sure that we've measured the impact on that. So my question really then, I think it's to Paul, but it's across to the board, is Paul, what do you think is driving our inequalities in Gloucestershire?
Ingrid, are you happy for me to pick that up? So yeah, thanks, Bran. Well, I mean, you know a great deal about this, and the evidence is quite consistent that healthcare in of itself only drives a relatively small proportion of health inequality, and the fundamental causes of health inequality are about all the other things, such as deprivation, such as housing, such as working life, such as other things like life chances, childhood adverse events, all the sort of things that affect people's lives more generally. So I suppose, just to pick up what you said and your question more generally, so the first thing is, I wouldn't argue I'm ashamed. I think I would argue I'm determined. As you know, I have the lead chief executive role on inequalities within our care system. I feel we've taken some steps forward by establishing a really close link now with the Health and Wellbeing Board, so that we develop some joint priorities to tackle health inequalities. You and I have been doing some work together on looking particularly at race inequality and how we improve our leadership understanding on race. In the NHS, for the first time for many years, we have that comes out directly out of COVID. We now have 8 urgent actions on inequality, which include things like making sure our recovery is done on an equal basis. So I think there's an awful lot going on the inequalities agenda, but I completely accept we've got a lot more to do, Bran. And it's in our communities, it's with our partners in all sorts of other organisations that we need to do it. And I think the development of the ICS system, closeness of it with the Health and Wellbeing Board, is going to be a big part of that. So, but it's a huge objective for us. So thank you for the question. I might have to swap my glasses, by the way, my battery's running out on this one, but I've got the other device open.
Bren, I know that we could have a seminar for the rest of the evening on this really big and important question, and we all have dialogue with you in other times and other places on this very thing. And I mean, just thank you, Bren, because you're one of the people that helps to connect us to some of the communities that we know are facing particular disadvantage, and you're a really helpful partner in that, so thanks very much. Laura, do you want to pick up the thing about sickness absence and how we benchmark, or Neil, would you like to comment on it at all? So Laura's question is in chat, but Laura?
I'm okay to just carry on because I know that, Neil has given an input on that, so I don't need to waste any more time.
Okay, great. Thank you very much, Laura. So those of you that saw Neil's response in chat, we benchmarked pretty well, in short, in terms of sickness absence rates. Any other questions from anyone before we close? Excellent. Well, thank you all very much for your patience. There is a last gasp question from Joy. Joy, over to you. Joy, I'm not hearing you. Are you on mute?
Can you hear me now?
Yes.
It's a request really to ask whether the Trust would commit to changing the language that's used towards people who are in suicidal crisis, so that in future patients who are under secondary mental health services and in suicidal crisis are no longer given the following messages, that they're no longer told directly, you have the mental capacity to make the decision to end your life. Alternatively, it's your decision to end your life, or it's your choice to end your life. I think these have been said for many, many years. I've been running a suicide crisis service for 8 years. And when I started running this service, these were the phrases that were being used, and 8 years later, they're still being used despite patients consistently telling us that these are very, very unhelpful messages to hear. Whether or not someone is assessed as having mental capacity, actually directly telling someone that they have the mental capacity to end their life risks validating that decision. And the phrases can be dangerous in many different ways. I absolutely accept that when they are spoken, they're not intended to be damaging or detrimental, but there's no question that they potentially are, and that patients who hear those, at the very least, usually find that very distressing to hear. In our experience, someone who is in suicidal crisis at the point of suicide is usually thinking in a way that is entirely altered, whether that's because they're being influenced by mental illness such as depression, or whether they're experiencing high levels of distress. And so for most people in suicidal crisis, they are thinking in a way that they wouldn't usually think. Therefore, being given those kind of messages are at the very least really, really unhelpful. We've raised this many times with the Trust, and it's not just in this NHS Trust, it happens in others, and we would really hope that the NHS Trust could commit. I realise you can't do that in this meeting, but to perhaps take this away, discuss it and think about it, and change the culture and change the kind of messages that are being given to highly vulnerable patients under secondary mental health services, where they have more severe and enduring mental health diagnosis. There's no question that this is being said. I haven't been a patient for many years, but it was said to me frequently up until 2016 when I was last a patient under your services, but it's being reported to us this year. And certainly I was told in a professional capacity about a month ago. I contacted the crisis team about one of our clients who's also a patient of the Trust. I was told directly, tell the patient that they have the mental capacity to make the decision to harm themselves. I said, I'm never going to say that to a client under our service, and none of our team would say that either. So I was actually asked or instructed directly by the crisis team to say that. So please talk to other patients. If you need feedback or understanding about the impact of those phrases, please talk to patients, because we've heard so much feedback and it's been consistently negative. It's potentially dangerous. You're potentially validating the decision, particularly to someone who's very mentally unwell. So please change the language.
Okay. Thank you, Joy. That's clearly an impassioned plea, and I can see in chat there are others that share your feeling on this. Paul, do you want to respond to that or ask a colleague?
Well, briefly, I will. I mean, that's clearly really important feedback in terms of language. I mean, we know in terms of suicide that the annual update on suicide progress on implementing the suicide prevention strategy, even before the pandemic, showed a worrying rise in suicide rates in the country. And we also now know that the pandemic has had an additional impact on suicide too. And we certainly have to commit to understanding the causes and how we can help and what we might contribute sometimes in that situation. So we'll definitely take the feedback on board. I don't feel I'm able to make a full commitment here within an annual general meeting, but we will certainly take it back into our professional forums and discuss it. And just to thank Joy for raising the issue with us. Thank you.
And that's exactly what I said. I didn't expect any kind of commitment.
Of course.
I've just raised this, and so I would ask you to take it away and discuss it, please.
Of course. Thank you.
Thank you. And you will have heard in John's presentation earlier that this issue is indeed one of our priorities for the coming year, and it absolutely needs to be the case that we listen to the people that we serve in those areas of our service. So it will get taken forward, Joy, as Paul says. Thank you very much indeed. Okay, any other questions? All right, well, lovely to see you all. I'm sorry we have overrun somewhat, but it's been a real pleasure to spend a little bit of time with you. I just hope by next year we're able to meet in person again and have a cup of tea and a proper catch up, as well as listen to information and share questions. But thank you very much, and thank you to all of you for your support to the Trust over what has been the most amazing year. Yes, we're looking forward to continuing in those partnerships in the coming year too. So thank you very much indeed, everyone. Take care. Bye-bye.
Thank you, everybody. Good to see you all. Take care.
Brilliant.